Hello and welcome to Mental Health Playbook, Marriage and Family Therapist, Rejections and Denials. My name is Mary Muko. I am a member of the WPS Provider Outreach and Education, or PO team, and I will be your presenter today. Joining me is my friend and colleague, Karen Curtis. Karen will be helping me today by monitoring the chat and providing you with additional information and links in that chat. If you have been checking out our live events webpage, you may have noticed multiple webinars beginning with the words Mental Health Playbook. These are sessions that we designed to give an entry-level introduction into Part B mental health outpatient services, those services that are submitted to Part B on a CMS 1500 claim form. Previous sessions can be found on our Encore Presentations webpage, as well as on our YouTube channel. Listening to the previous sessions is not something that is required in order to understand what I'm going to be covering today, but I just wanted to make you aware that additional education is available. Our objective is for learners to receive that entry-level introduction to Part B, Medicare, original Medicare, that is, outpatient mental health services. And today's focus during this presentation is data-driven. The topic is Part B, Marriage and Family Therapist, Common Rejections and Denials. And the agenda should look very familiar, as these are the topics that we identified when we presented the webinar description that you were able to register for, or during registration. You will have seen these same words. Today's session is not designed as a question and answer session. However, if time permits, we will have questions at the end of my prepared remarks. So during this session, I will define a rejection and denial and reveal the most common reasons why WPS rejects claims submitted to WPS and denies claims submitted to WPS based on data for your specialty, that is for marriage and family therapist specialty. So we're looking only at claims submitted by those providers who have enrolled with WPS as a marriage and family therapist. As I mentioned, time permitted, I'm going to respond to presentation-related questions. I'm going to be sharing ways to fix and avoid both those rejections and denials, and provide you with just a ton of resources that you can come back to later if you have questions. Keeping in mind, of course, that you're always able to pick up the phone and call customer service as well. I'll be providing you with some other ways to find information about the rejection or the denial as well. So let's go ahead and get started here with rejections and denials. I want to talk a little bit first about the remittance advice and how it relates to rejections and denials. Sometimes we call the remittance advice an RA, other people just call it the notice or the remit. But a Medicare remittance advice, or RA, is that notice that is sent by Medicare administrative contractors, or MACs, to healthcare providers, and it explains claim rejections or the adjudication of claims, which includes payments, adjustments, and denials. The RA includes codes, reason and remark codes, and group codes that explain why a claim rejected or denied or partially paid. And it also explains, or some of those codes also explains, the financial liabilities. The remit is also going to list any deductibles or co-payments and reductions. So most providers currently receive an electronic remittance advice, with only a few that still receive that standard paper remittance. Providers can use self-service tools to access additional claim information, including a helpful reason and remark code lookup feature that we have on our website. If you're looking now at slide 4, you will see this is one of the sub-bullets that I've listed. Anytime you see the verbiage that appears in a blue colored font, looks like it's also underlined, that means that it's an embedded link. So if you are looking at the electronic version or the handout, you can simply go here and click on reason and remark code lookup, as I'm doing right now, and it opens that particular resource or tool right up for you. It's just taking its sweet time this morning. So that is a tool that's on the WPS website. So you're going to get that pop-up if you haven't already logged into the website yet today or on the day you look for this, and you'll need to choose your jurisdiction. I'm just going to choose J8 Part B, and you'll also need to view and accept the AMA licensure agreement, the CPT copyright. Speaking of CPT copyright, you will find at the end of your slide deck or at the end of the presentation materials our disclaimer form that talks about the fact that I made every effort to make certain everything is current in your presentation materials, but it is subject to change. And there's also a slide, if you look to the end of the presentation materials, that includes that CPT copyright, the same one that you agree to when you use our website. So this is that tool, that reason and remark code lookup. So if you're looking at a remittance advice and you see a claim adjustment reason code or a remark code, you can enter it here into this lookup tool and click on search. Tell us if it's a claim adjustment reason code or reason and remark code or all reason codes. You can also choose to include only partial matches. So if you type in a code here that you see on your remittance advice and then select search, it will give you the code. Let me just try another one. It will give you the code. And I am just not having very good luck today choosing a remark code or reason code off the top of my head. So that's why it's not bringing back anything. All right, we can come back to that later. Moving through here. I'll give you an example of some reason or remark codes in just a little bit. Another helpful tool is SNAP. That is the SecureNet Access Portal, which is the secure side of our website. And in addition to use of that tool, we also make available to our customers the portal user manual, which includes both illustrations and step-by-step instructions to using all of the functionalities in SNAP. So I'm talking about this now because you can look at claim details if you have a claim denial, for example, and it will give you more information that pertains to that particular denial. You can also click on a button in SNAP when you're viewing claim denials. The button says more info, and it will provide you with more info about the particular denial. Let's say that your claim denies due to frequency or due to coverage requirements that are placed in one of our local coverage determinations. The SNAP feature for the claim details, when you click on that more info button, will provide for you the reason that your code or your claim line denied was relative to a local coverage policy, and then it will actually allow you to click on a link and view that policy right then and there. So it just provides you with ways to find more information related to that denial. We also have the IVR system, which is the integrated voice response system, and we have an IVR operating guide to help you maneuver through that system. And the IVR system is that touch-tone phone system that you can use to find information about why your claim denied or why it rejected and so on and so forth. So some great resources there. Now let's talk about the difference between those. And I said integrated voice response. Years ago, it was the integrated voice response or the IVR system. It's now the interactive voice response system, IVR. So I needed to make a correction on what I just said there. I want to talk about rejections first, and I really like to explain the difference between a rejection and a denial because they are very different. Sometimes we use the words interchangeably, and we really shouldn't do that because they mean different things. A rejection is referred to by CMS as an unprocessable claim. What that really means is that it's not adjudicated, it's returned on what we refer to as the front end. The reason we return an unprocessable claim is because something is invalid or illogical often because something that's required on the claim is missing or incorrect. Because a rejected claim is not adjudicated, there is no right to an appeal. You can easily identify a rejected claim on a remit when you see the remark code MA130, and that's one that I should have used when I was looking them up earlier on our tool, or a group code CO16, and you'll see both of those listed here on slide 5. What do you need to do if your claim rejects? You need to fix it and resubmit it. The patient cannot be held liable for payment because your claim is really not adjudicated. It's simply rejected. Let's talk now about denials. A denied claim is adjudicated. Medicare denies claims for a number of reasons, some of which are listed here on this slide. There may be a law or what we call a statutory requirement that keeps us from making payment for a line item on a claim or for the claim. Perhaps we deny the claim due to the not meeting the criteria in one of our local coverage determinations or a national coverage determinations. Those are both forms of policies. Policies equal edits, and policies define medical necessity. A frequency denial or a utilization parameter is also considered a medical necessity denial. And remember, for those services that Medicare denies as medical necessity or for medical necessity reasons or not meeting medical necessity, those would be those situations where you might want to consider presenting your patient with that advanced beneficiary notice of non-coverage or the ABN. Other reasons for denials, and these are just a few examples right now, are due to eligibility. Now, this could be that the beneficiary was not eligible on the date of service. Maybe his or her coverage had not yet started when the service was billed, or maybe his or her coverage had already terminated when the service was billed. So beneficiary eligibility. There's also denials that occur due to provider eligibility. Maybe it is that Medicare does not allow payment of this service to this particular specialty, this provider specialty. And specialty codes are assigned when a provider enrolls in Medicare. Now, some providers are eligible to self-designate their specialty, like an MD or a DO. An MD can say, my specialty is urology or my specialty is psychology, while other types of Medicare providers don't self-designate. There is just one set code by CMS to identify that particular specialty. So, for example, marriage and family therapists are a specialty E1, okay? So when marriage and family therapists enroll, they don't self-designate their specialty. They are assigned specialty E1. Another bit of information about denials is on that remittance notice. Typically, not always, but most often with few exceptions, you will see an MA01 code that appears on that remittance advice, and that code provides the appeal rights. For denied services, the Medicare patient's liability is determined. So when your claim rejects or denies, you need to consider actions to take. For rejected claims, you would fix the error and resubmit the service. But for a denied claim, there could be multiple actions to choose from. Sometimes you can simply fix the error and resubmit it, similar to what you do to fix a rejected claim. You can also consider using the SIR process, the clerical error reopening process. Registered users of our SecureNet Access Portal or SNAP can do it yourself, use self-service and render those clerical error reopenings as opposed to calling one of our customer service folks and having them render the clerical error reopening, or I should say designated staff, not necessarily customer service, that will perform those clerical error reopenings for you. Now, not all claims can be fixed using this process. We do have a helpful article out on our website that tells you these are situations where you can use the clerical error reopening process versus those that you cannot use that clerical error reopening process. And I can show you that article in just a bit. Another thing to consider doing with a denial, with most denials, with few exceptions, is to request an appeal. And of course, you can use these self-service opportunities to do that if you're a registered user of SNAP. It really does speed up the process. I want to show you really quickly, and I'm using my other monitor to get it ready so I can pull it open, show you. I'm going to go out to the WPS website. And here it is, just having a little bit of a lag time here. So thanks for sticking with me here. I've opened the WPS website. You can see the website address is here at this top, www.wpsgha.com. This is the home page of our website. I talked earlier about that portal user manual, and you can find a link to that so that you can find those illustrations and step-by-step instructions for using our SNAP. Here is a link to the portal user manual. This is the box if you're a registered user of SNAP to log in. The portal user manual is also available by scrolling to the bottom of any web page and looking under educational opportunities, and right here is that portal user manual. I also talked about that IVR operating guide. It's right here, the links to the Part A IVR operating guide and Part B. Back to the top, I'm going to type in, I'm a searcher, not a navigator, clerical error reopening. I'm going to search for that. Again, I'm going to select Part B. This time I'll select J5 MAC Part B. You'll be presented with that mapping of our jurisdictions when you log into our website. Another way for you to tell which one of our websites you're on, this is J5 MAC Part B that I chose when I chose that mapping of Iowa, Kansas, Missouri, and Nebraska. But if you're one of those people that prepares and submits claims for both Jurisdiction 5 or Jurisdiction 8 states, you might want to pay attention based on what you're working on to the J8 MAC Part B website versus the J5 MAC B website. The reason for that is because some of the addresses and telephone numbers are going to be different. So I like to look at an article on our website called How to Request a Clerical Error Reopening. That provides that definition of the clerical error reopening. Remember, it's a process you can do yourself to speed things up. And this is that article I mentioned to you that tells you what are those corrections that can be processed as a clerical error reopening versus what are those that cannot be processed as a clerical error reopening. All right, back to the PowerPoint. Right, at this point, we're going to move from the definition of a rejection and a denial into that data itself. And it is CMS that requires MACs to utilize data to determine our education strategy. And our data specialists have created a dashboard so that those of us in provider outreach and education can analyze claim submission rejections and denials to determine our education needs. And just as advertised, today's webinar reveals the most common reasons why WPS rejects or denies Part B claims for marriage and family therapists, those that are assigned that 2-digit specialty code of E1 when they successfully enroll in Medicare. Now, specialty codes, as I mentioned, are self-designated by some providers. Some providers that do self-designate can also report a secondary or tertiary specialty. However, it's important for you to know that during initial claim processing, only the primary specialty code is used. So the claims processing system, that logic that the computer uses, applies only to that primary designated specialty. And why is this important? Think about this for a minute. How does Medicare know when more than one provider is seeing the patient on the same day and know that they have the same specialty or a different specialty? It's based on those provider transaction access number, those provider numbers that are placed on the claim, and then connected to that provider number on the claim is that specialty code in the eligibility files out in PAYCOS, that provider enrollment chain and ownership system. So that is how the computer recognized that both a psychiatrist and a clinical social worker are seeing the patient on the same day. Or maybe a social worker and a marriage and family therapist is seeing the patient on the same day. And remember, I talked about edits before. In order to make certain a claim is medically necessary, those edits are put into place in the claims processing system so that the claims processing system, sorry about that, can check those specialties. You know, is it appropriate for more than one provider to see the patient and provide services to that patient on the same day? Is it medically necessary? It is the Social Security Act that states that no payment can be made for any item or service that is not medically necessary. So that's the overarching criteria for payment. Obviously, or of course, the Medicare service would also need to be otherwise covered by Medicare. What we mean by that is that it was provided to an eligible patient by an eligible provider, and so on and so forth, that it wasn't a duplicate. So that's what we mean when you hear us talk about otherwise covered by Medicare, or otherwise. Yes, otherwise covered by Medicare. I got distracted there for a moment. Sorry about that, folks. So we're going to talk about the data now. And remember, it is CMS that requires all of us in provider outreach and education to consider the data or to look at the data to determine what we need to educate about. So what we hope to do is provide this education to our providers and then look at the data later and see how the data is, what the trends are. You know, are the number of rejections and denials increasing or are they decreasing, and so on and so forth. So I want to talk a little bit about that dashboard that our data analysts in a department called Insight created for us. So we have the dashboard, and when we look at this dashboard, we can use what our data team calls data slicers or filters to ask for results related to what we're specifically interested in seeing. So for this webinar today, I used all of the Part B claims that were submitted January 1 of 2026 through March 31. The data was last refreshed by our Insight data team on April 6th. So this is, you know, fairly recent claims data. I looked at both jurisdiction 5 and jurisdiction 8. And this webinar today is designed only for marriage and family therapist rejections and denials. And I wanted to see all of the codes that were subject to these rejections and denials. So what I have done here is prepared to show you live what that dashboard looks like. And how it works. So I'm looking at denials. Here are those data slicers I talked about. I'm looking at both jurisdiction 5 and jurisdiction 8, so it says all. I'm looking at only Part B claims, but I can quickly change this to Part A if I'd like by using this little eraser. I'm going to look today though at B. I can look at rejected claims versus denied claims. See how quickly all of this data is changing? Boom, boom, boom. Let me get rid of that first. Just like that, with the click of this mouse, I can look and change the data, what I'm looking at or what I want to look at. Today we're looking at, you see E2 up there. That's because I'm preparing for my next webinar. Actually, I'm looking at E1 right now, but the E2 was there, and I keyed the same thing. So we're looking at E1 specialty claims. That's that 2-digit specialty code. That means this is a enrolled WPS Part B, enrolled marriage and family therapist. I could choose if I want. Let's say I'm going to Michigan to do a presentation in Michigan. I can choose just to look at only Michigan data really quickly. Boom, boom, just like that. or I can look at all states. I can even drill down to counties, you know, and I have done that. If I have been invited to speak for a particular association or society or professional organization, let's say I'm going to Grand Rapids, Michigan, I can pull just the information for the county where Grand Rapids is located. So it's just amazing how quickly, just with the click of a mouse, we can view the data. We can also look at trending. You see here is a reason or option for trending. And this shows, I'm going to take the denial code away. This will show all of the denial code descriptions and denial codes. It tells us the claim count this for the current 3 months, because if you look at the data, the dashboard here, each time we view the dashboard, you view 3 months of data. The data analyst will come in each month and take the oldest month away and add the newest month. So there's always three months of data out here, and it tells you the last time they pulled. So they've updated this report since I prepared your handout for today's presentation, because this is data February through April. That was refreshed on May 12th. So you can see by just changing these data slicers, you can see the various denial code descriptions, the count for this 3 months, the count the previous 3 months, the difference in claims. It gives us a percentage, and then it shows a green arrow that means it's going up, or a red arrow going down. And obviously what we want to see here eventually is all red arrows. So we continue to look at this data to determine our education needs. So I did look at the data, and here in descending order for you are the top 5 reasons WPS rejected marriage and family therapist claims. And remember, for rejections, you need to fix it and resubmit it. So the number 1 reason we rejected claims during that time period I looked at was that the rendering physician number on that claim was invalid or missing. What do you need to do? You fix it, resubmit it. So if this was the reason on your remittance advice why the claim line denied, excuse me, I said denied, I meant rejected. What you need to do is look and zone, focus on that rendering physician number on the claim. Is it invalid? Was it keyed wrong? Is it missing completely? You need to fix it, resubmit it. Number 2, the facility or lab name and address or PIN was missing. What you need to do is find that facility, lab name and address or PIN and put it on the claim and resubmit it. Number 3 is field 11 of the claim must be completed, and this is that item on the claim form, on the paper claim form or the electronic equivalent. This is the field that asks you, is there other insurance that is primary to Medicare? And if the answer is no, you still need to fill out the field. And this is where a lot of providers are getting rejections because they're not putting the word none in field 11. It cannot be left blank. If it's blank, your claim is going to reject. You need to fix it, resubmit it. So there may not be another insurance that is primary to Medicare, but you still need to fill out the field and say none. Missing, incomplete, invalid billing provider primary identifier, very, very similar to item number 1. Sometimes you'll see both of these on the remittance advice at the same time. And number 5, incomplete, invalid plan information for other insurance. Well, what does that mean? That means that you told us on the claim that there is another insurance for this beneficiary, but you failed to place all of the information on the claim to identify that plan. I'm going to show you in just a little bit where you can find the claim form instructions. I'll actually provide the resource for you. So what are the top rejected codes for marriage and family therapists? I told you the reasons, top 5 reasons. Here's the top 5 codes. 90837, 90834, and 90832 are all individual psychotherapy. The first one, the 37, is 60 minutes, the 34 is 45 minutes, and the 32 represents 30 minutes. So those 3 codes for individual psychotherapy were in the top 5 rejected codes for marriage and family therapists. 99309 was the second most commonly denied code, rejected. I caught myself again there, folks. Rejected code for marriage and family therapists. And this is an evaluation and management, or E&M, nursing facility visit, 30 minutes, or one with the medical decision making of moderate complexity. That's the second most commonly rejected code for your specialty. And finally, 90791 rounds out that top 5. That's the initial psychiatric diagnostic evaluation without medical services. So let's take this a step further, because the education I'm providing today is in the hopes that we're going to see fewer rejections of these codes for your specialty, for those of you that are attending today. So let's look at the reasons for each of those codes. 90837, 60 minutes, individual psychotherapy. The number one reason we rejected it was that field 11 of the claim form must be completed. Easy to fix. Go back and make certain that field is filled out. Facility, lab name, and address are PIN missing. Make certain that information is placed on the claim. And again, I'll provide you with a resource in just a minute. We'll show you what you have to put in each one of the fields on the CMS 1500 claim form. That's the claim we're talking about today. And incomplete, invalid plan information for other insurance. So these are all reasons that hit those top 5. So looking ahead then to the 99309, the E&M facility. Why are we rejecting that code? I only added the one reason here. The rendering physician number was invalid or missing from the claim. 90834, 90832, a couple more individual psychotherapy codes. Here are the reasons. I'm going to let you just kind of glance at those. A new one showing up here is the 90832, the first bullet. So the top rejection reason for 90832 is that the clinic number was missing or wasn't entered accurately on the claim. Okay. And 90791. Remember, these are rejections, not denials. Invalid or missing modifier was the top reason. Facility, lab name, and address or PIN missing. Let's take a look at the third sub-bullet there. The claim must be submitted to RRB. And if you look in the notes section of your handout for this slide, it will tell you that RRB stands for Railroad Retirement Board. For those Medicare beneficiaries who are retirees of the railroad, there is a specialty contractor that processes all claims. That specialty contractor is the Railroad Retirement Board specialty contractor. It is a contractor by the name of Palmetto GBA. These claims for 90791, the third most common reason we rejected them at WPS is because the claim shouldn't come to WPS if that beneficiary is a railroad retiree. It should go to Palmetto GBA. I'll show you some resources later which will help you identify where to submit the claim. CMS actually has an interactive map out on their website where you can click on any state and it will tell you. For MAC claims, send your claim here. For the Railroad Retirement Board, send your claim here. If you're looking for information on one of the medical review contractors, that information is out in that interactive map. So a lot of great information out there. So you would need to check eligibility for your patient to see, are they a railroad retiree Medicare beneficiary? You would use various self-service tools to check eligibility. Another way you can check on this type of eligibility is to ask your patients when they present at the office, do you have a specialty contractor as your Medicare administrative contractor? Are you a railroad retiree? You can also look at the Medicare card itself if you ask to see it, because if that patient is a railroad retiree, it will show that right on their Medicare card. The banner along the bottom of the card is different than for those beneficiaries that have the original Medicare administrative contractor processing their claims. The emblem on the Medicare card for a railroad retiree is also different than the emblem for those with original or traditional Medicare that's processed by the MAC. All right, we talked about rejections. Let's talk about denials. Here are the 6 reasons for denials in descending order. The number one reason we denied claims is collection of fee for service during periods of managed care. And that's what would be printing out on the remittance advice. And that one's a little cryptic. There is another specialty or another contractor that manages the reason and remark codes or maintains those codes for CMS. It's not WPS, so we can't change how that's worded. But what that really means is that the beneficiary has Part C. They have managed care, Medicare. They are not a traditional or original Medicare beneficiary. So the number one reason we're denying claims submitted by marriage and family therapists is because the beneficiary has elected a Part C plan in lieu of traditional or original Medicare. So the claim goes to the plan, not to WPS. Look at number 2 and number 3. The number 3 reason we denied your claims for this specialty was because they were duplicate. This tells me that perhaps claims are being submitted before the initial claim is being processed or being resubmitted. You're not waiting or you're not checking the status on the claim. You're just automatically resubmitting those claims into Medicare before checking the status. Providers need to check the status of their initial claim to make certain they're not inadvertently submitting a duplicate claim. If you submit a claim with the same information on it, it's going to deny. If you're hoping to resubmit something, then you need to make certain that something is being changed. If you were to put $1 on every single claim of yours that denies for duplicate, there's different kinds of duplicate. You know, sometimes it's a duplicate we've already paid on another claim. That would be number 2. Maybe it's a duplicate that we're currently processing another claim for the same exact thing. That the ICN that's now being processed is the duplicate. If you were to put a dollar amount on every one of those, think of all the money you could save if you didn't submit those duplicate claims. Think of all the money that Medicare could save if we didn't process those duplicate charges. You're preparing and submitting your initial claim. Medicare is taking that claim and denying it. You know, if you're submitting another claim without checking the status of the first claim, there's another dollar amount, you know, that you could associate with that claim. So the dollar amounts that are used inappropriately or spent inappropriately for duplicate charges can really add up. So we need to make certain we're taking all efforts we can to eliminate those duplicate charges claims. Look at number 4. The time limit for filing your claim is expired. No appeal right. How many times have you heard me say today, most often you have a right to an appeal, but there are exceptions. This, folks, is that exception that I talk about when I provide education. You have 1 year from the date of service to file your claim. If it's submitted later than that, your claim is denied. You have no appeal right. If you're looking out, and this is included in the, what do I want to say, in the resources. Open this up quick. I can get it. My mouse doesn't want to work here. Let me go. Try this again. All right. Make this a little bigger. I'm going to look here and find for you timely filing. Timely filing of claims. There we go. Trying to make it a bit bigger so you can see it. Here's the resource on our website that talks about timely filing of claims. It talks about the fact that there are no appeal rights. One thing that I want to point out to all of you attending today is this section. Providers often ask us to reopen a claim for timely filing if another insurance recouped their previous payment. If that's what caused the delays, CMS in their internet-only manual, and we have a link to it right here, says we cannot open or reopen your claim. We cannot waive the timely filing. So this is the verbiage that you'll find right in that manual that tells WPS you cannot reopen that claim just because a third-party payer paid and took back the money. And this is what we hear most often when it comes to denied claims that weren't filed within the time limit, that it's due to a third-party error. So let me give you an example of that. Another insurer you believe is primary for the patient, they make payment on the patient, and 3 years later you get a letter from that other insurance company saying Medicare was primary, give us our money back. We cannot reopen that for timely filing. It is not good cause for the purpose of reopening that initial determination or redetermination if we process the claim in accordance with the information that was provided. So I just wanted to pull that out to you because we've seen an increase in this rejection. I want to point that out to you rather. All right. Let's go back here. The physician is not eligible to receive payment. That would be an issue you'd want to check with enrollment. Why is the provider not eligible to receive payment? Were they not eligible on that date of service? It would be a provider enrollment issue. And number 6 is that the claim must be sent to the employer group health plan first. That means that Medicare is not primary. You need to send it first to that employer group health plan. Here are the top denied codes, all very similar to those that we talked about earlier. The 37, 34, 32 are all individual psychotherapy. You'll see that 90791 up there, which is the initial psychiatric diagnostic evaluation. I'll be hosting a webinar that speaks specifically to denials of 90791 and 90792 in early June. If you're interested in looking at that, most often these are being denied due to frequency. But I'm going to go into a little bit more detail in that webinar because I'm focusing only on the 90791 and 90792. We'll talk about that code in just a little bit more. 90847 is family psychotherapy, and 90853 is group psychotherapy. So let's look at the reasons why each of these are denying. The 837 and 834 are both individual psychotherapy. We're denying because the patient had managed care, Part C. Provider's not eligible, duplicate charge. Same thing for the 34, except look at that last bullet. Medicare will not pay for this service for this condition. That means it's related to policy. The CPT code 90834 was reported on the claim with a diagnosis code or an ICD-10 code that is not covered by WPS. This service is not covered for this condition. How do you know what we'll pay for? You need to look at the policy and the billing and coding guidelines. The billing and coding guidelines has the list of CPT codes and the list of covered diagnosis for those codes. Sorry about that. Got a little click happy there. 90791, why are we denying it? Well, the number 1 reason was because the beneficiary has Part C. Number 2, Medicare does not pay for this many services in this time period. Look at the policy, look at the billing and coding articles, and it will tell you that Medicare will only pay for this service once at the onset of the illness. And doesn't pay for it again until 6 months has passed. It tells you in the policy and in the billing and coding guidelines what this contractor, WPS, considers as the frequency, and it's once per 6 months for each patient. So it doesn't matter if another provider is billing it and you're billing it. And that's what I'm going to go into a little bit more detail on during that June webinar. Medicare does not pay for this service for this condition. That means the diagnosis on the claim is not one listed in the billing and coding guideline, that companion article to our policy. Not covered when performed, referred, ordered by this provider. All reasons we've talked about before, or some of those are. The 90832, again, patient has Part C, duplicate claim. Payment included in another service received on the same day. So that's a bundled service. One of the webinars that I hosted previously was same-day services and bundled services. We hosted that back probably in February. So if you're interested in more information about bundled services, I would suggest that you take a look at the mental health playlist out on our YouTube channel and give a listen to that recording, or take a look at it. 90847 is family psychotherapy. Here are the reasons why we are denying it. Again, Part C, patient or the provider's not eligible to receive payment, and a duplicate. 90853, Group psychotherapy, the number one reason we denied that code is that the claim must be sent to the employer group health plan first. Second most commonly denied reason for that code is patient has Part C. And the last is that the provider is not eligible or certified for the service on that service date. Okay, so that would be an enrollment issue. Check the provider eligibility file. Ways to fix or avoid. I've talked about some of these as we've gone through this presentation today, so I'm providing for you a lot of resources to come back to. I talked earlier about rejected claims, that something's missing from the claim, something's not logical. These are your claims processing guidelines. If you look at today, we're talking about the 1500 claim form, which is chapter 26, completing and processing that form. But if you look at chapter 25, you can see the CMS 1450 or the Part A claim information, and then I provided some general EDI information there for you. I want to show you real quick here. Going out to CMS. Bear with me, I'm pulling something up here on my other screen. Now I'm just going to go this way and do it. I'm clicking on the embedded link. It just takes a little while. CMS updates their website on Thursdays, so I find sometimes when I'm going out to the CMS website, it's a little slower on a Thursday. But here's where you can look at the claim form instructions for Part B, and I'm going to scroll up, so look away if that makes you dizzy or bothers you. As you're looking for the claim form instructions, this is the CMS 1500 claim form instructions. I mentioned to you that it will tell you what you need to put in each of the items on the claim form. Item 1, this is what goes there. Item 1A, item 2, so on and so forth. So this goes box by box or item by item through a 1500 claim form and tells you what you need to put on your claim. Another thing that's very, very helpful for making certain that all of the information is present on the claim that's required is to use the crosswalk. This is something that our EDI staff has created. It shows you the item number on the claim form, the narrative, what it is that goes in that box. It tells you if it goes in item number 1 on a paper claim form, where does it go on the electronic claim form? What is the data element description? What is the loop? Or where's the loop or the claim segment? One of the things that I like to point out, and I'm going to open this up here quickly on my other screen, as I mentioned. Hang in there, getting there. All right, pulling this over here for you. That's a screenshot in the claim form, so I can't move it around and demonstrate. I'm going to make this a little bigger for you. All right, so item number 1 is your type of health insurance. It tells you where it goes on the electronic claim form. So it crosswalks. If it goes here on the paper claim form, this is where it goes and what it needs to say on the electronic claim form. The important thing I want to point out here is the status code column. See these R's? There's also an S here or S here. R means it's a data element that is required in order for us to process a claim. If you do not place on your electronic claim form any item that has an R in the status code column, it's going to reject. Okay, so this tool will help you recognize what it is that you need to enter, what format, how do you enter it on the electronic claim form, and where do you put it. Okay, so this is a great tool. Some providers have never seen it, so I like to show it. Provider eligibility, for those errors specific to eligibility, you know, this claim is being denied because the provider wasn't eligible on this date of service. You know, go to provider enrollment and check. Make sure you're keying identifiers correctly on the claim form. Make certain you're entering the rendering provider, the ordering provider, the referring provider when you're required to do so. And check those eligibility dates in the provider's enrollment records and make certain that they're up to date and correct. Similarly, patient eligibility, you know, Ask the patient, do you have more than one Medicare card? Sometimes they do because they hang on to some after they've made a change. You know, maybe they've moved from traditional Medicare over to Part C. Make certain that they're showing you everything they have. You know, look to see that card if it's a railroad retiree. You know, sometimes the patient elects to enroll in hospice. And the eligibility for that patient shows they're in hospice. So all of the claims that are associated with the terminal illness need to go to another contractor, not to WPS. So these are things to consider, all related to patient eligibility. Make sure that the patient's name and number or MBI on the claim match exactly also. If the patient has a middle initial on their Medicare card, make sure your claim also has a middle initial on it. Modifier issues, you know, make certain you're adding those required modifiers, that that modifier is one that goes with that procedure code, and that that modifier was valid for the date of service that you're billing. We have modifier fact sheets out on our website, all kinds of them. Show you real quick here. Trying to make it bigger. Searcher, not a navigator, so I am searching for modifiers. Well, if I spell it right, there we go, modifiers. Our modifier web page has links to all of these modifier fact sheets. So you can choose these. They provide the description, they provide appropriate use, non-appropriate use, and sometimes even more information. Verify that you're not auto resubmitting your claims before you're establishing status. We don't want to continue denying thousands of claims every day that are duplicates. It costs you money, it costs your employer money, and it costs the Medicare program money. Sometimes there are modifiers that you need to append to tell us or to tell Medicare, this is a repeat procedure by the same provider on the same day, or this is a repeat procedure by another provider on the same day. So make certain that when the situation calls for it, that you're using an appropriate modifier to avoid a duplicate denial. You can consider the use of the IVR system or SNAP to see if the claim has already been processed or is in process. Here's some resources to avoid those MSP denials, and you'll see the police cars over here. That's actually a photo of police cars at the scene of an accident. If a beneficiary is involved in a car accident, maybe there's another insurance that's primary to Medicare. There are a lot of great resources we make available. There's recordings available on our YouTube channel of all kinds of information related to Medicare secondary payer denials. Here is a link to our policy and a link to the billing and coding guidelines for WPS psychology and psychiatry services. I will be diving into those 90791 and 90792 denials in that webinar in June. But it is in this policy and in this billing and coding article where you're going to find those guidelines that speak to that 90791 and the fact that we only allow it once every 6 months. If you're looking in here, it's right here. It's the information about the 90791. Same provider may repeat it if for some or for the same patient after an extended break in treatment occurs, or the patient requires admission to an inpatient status, or for a significant change in mental status requiring further assessment. We have both the billing and coding article and the policy itself. This happens to be the billing and coding article. This is also where we provide the CPT codes. There's 25 of them here. All of these codes for psychology and psychiatric services have a specific group. These are there's a group 1 code listing and a group 2 code listing. This is where you'll go for the group 1 codes to see what are the diagnoses that Medicare, that WPS considers as medically necessary. Okay, lots of them. Okay, lots. The group 2 code list is only for code 90880, and that didn't hit on your top rejections and denials. But use this to determine, does WPS Medicare, because this is a local policy, it applies only to WPS claims, make certain that your codes are covered based on the list of ICD-10 codes. That was hard to get out today. Some of the denials we've seen for your specialty are because the patient was in custody. So here is an MLN, or Medicare Learning Network, fact sheet about patients in custody under a penal authority. Tells you when Medicare will pay or won't pay. Typically, if the patient is in jail or is incarcerated, Medicare is not going to pay for that service. Timely filing of claims, I showed you where you can find that information about timely filing. Remember, timely filing due to third-party errors does not qualify for that waiver of timely filing. You do have to have a good cause to submit a request to waive timely filing to our claims manager. Third-party error is not considered that. Here's some information I've included about Medicare managed care, because we saw a lot of denials because the patient has elected a Part C plan. So I've included these resources for you. And then here I've just categorized resources where you can come out, you can look at that reason or remark code on your claim, come out to these resources, find that reason or remark code, and it provides you with tips for correcting your claim. So here's a resource on our website. We also have several rejections and denials videos on our YouTube playlist. Here's for eligibility help, and MLN fact sheet just talks about using the tools to find eligibility information. I showed you the modifier web page. And we also have YouTube videos, several of them. You can look at our modifiers playlist if you're having troubles with any specific. Our common claims denials resource on our website arranges by category information and help for certain types of denials like bundling or entitlement, duplicates, and so on and so forth. Again, the resource includes those reason and remark codes that you'll find on the remittance advice. So find it, match it up, it tells you how to fix it. This is information on the clerical error reopening. I showed you this earlier. You do have 1 year from the initial remittance advice notice to submit or to have a clerical error performed. This is just some information on the 5 levels of appeal, and for 2 of those 5 levels, the amount of controversy you need to reach in order to submit that appeal. I like this flow chart because it tells you how many days you have to file the request, and for all but 1 level of appeal, it tells you how many days that entity has to render their decision and send you that notice. So this is just a helpful tool related to when you need to request an appeal. And here's just some information that we're providing at all of our webinars that is specific to overpayments. And what we're talking about here, folks, is those overpayments that you discover. Those that we don't ask you for. These are when you find an error and you want to return funds to us, or you want to say, hey, WPS, we found an overpayment. Can you set up a request for the overpayment? So we're providing you with some of these resources here and providing you with some instructions on how to let us know that you are returning a refund or you want us to set up a request for the refund. We are at 11:02. I've gone over just a little bit, folks. I know I've showed you a lot of resources during this presentation and gave you a lot of resources. I want to make sure that you know that your questions are important to me. I will answer any questions that you send in for a period of 7 days following this event, and I'll talk a little bit more about that in just a minute, but unfortunately, we don't have time for live questions today. We do want you to take a little bit of time to tell us about this WPS education experience. Karen has placed a survey link into the chat. There's also going to be a redirect after you leave the webinar. If you've not yet provided feedback, you can do so. There's going to be a pop-up that appears. Looks like what you see here with the yellow triangle at the top and the blue continue button. So if you've not yet taken the survey, this just gives you one more chance to do so. Your feedback is really important. It really helps us know your preferences and what you'd like us to consider providing education about in the future. Both CMS and WPS look at all of those survey comments. I do want to thank you once again for attending and talk a little bit more about how you can send me those questions following today's presentation. If you have a question for a period of 7 days, I'll be able to take those questions from you. You can send them to our education mailbox. It's wps.gha.education@wpsic.com. If you would please, in the subject line, place marriage and family therapist in there, and they'll know to send those questions over to me. I will respond either directly to you with an answer to your question if it pertains to what I talked about today, and I will create a list of questions and answers and send them out to all of you. And I apologize for running short on that time today. Now, after disconnecting today, you're going to receive a thank you for attending. That email is going to come from WebEx, not from WPS. This is the email that you can submit to an accrediting organization for continuing education units. Now, if you joined only by phone, in other words, you're not seeing the presentation today, you're just listening to me, WebEx will not be able to generate the same email to you. You're going to get a sorry we missed you email because WebEx doesn't recognize your telephone number. They only recognize those email addresses that were used when registering. So their participation reports don't match up the telephone number with an email address. So if you join by phone and you need CEUs, send us an email at our education mailbox, wps.gha.education@wpsic.com. In the subject line, you're going to add, need CEUs, and make certain when you're emailing us that you tell us the name and the date of the event and that 10-digit telephone number that you called in from. We'll check our participation reports, match them up, and then we will send you an email that will come from WPS. It'll have verbiage in the body of the email that you can use to request those CEUs from accrediting organization. Neither one of the emails, whether it comes from WPS or if it comes from WebEx, will include an attachment. There's not an actual certificate per se. It's actually embedded in the body of the email itself. It's in the email verbiage that says the name of the webinar, the date, and the total contact time. Again, if you think of any questions, those can be emailed for up to 7 days. So this does bring us to the end of today's presentation. On behalf of myself and the Provider Outreach and Education team, and Karen, my assistant today, I would like to thank you for being here, and I hope you will join us for future events. You may now disconnect. Thanks, everyone.